Hey guys, come along with me today to do a neurotoxin treatment. As you can see, I have this patient's frontalis marked up. I have those lateral borders of the frontalis marked up, and I started injecting right on that lateral border to ensure that I do not spock her brow. As you can see, I marked up even injection sites across that frontalis to make sure that this patient gets a nice even diffusion of that product throughout her whole frontalis. And I'm having that patient move towards me, so I'm injecting at a comfortable angle. As you can see, I'm injecting at a 45-degree angle. I'm utilizing half of my needle depth, and I'm going in the tissue, pushing product, coming out, and then moving to the next injection site. Now I'm moving on to the glabella complex. This is made up of 5 different muscles. So you have your procerus, which is that muscle that is 90 degrees straight, full needle depth. And then you have medial and lateral corrugators on each side that pull the brows together and make those 11. So when you have a medial and lateral corrugator, you want to make sure that you're injecting your medial corrugator at 3/4 needle depth and your lateral corrugator at half the needle's depth, just to ensure that you don't get a brow ptosis and you don't hit the frontalis that is laying under those corrugators. Next, we're moving on to the masseters. As you can see, I kind of drew up of where my safety zone is. So it's always from the corner of the mouth to the tragus. Underneath that is where you'd like to inject your masseters. What I usually do is I place 2 fingers over that bulge of the masseter muscles, have my patient clench, and then I mark an anterior and posterior border of that masseter. I usually do a 2 to 3 point injection site here just to make sure that my patient does not get a fish gill, and so that muscle gets product distributed through it evenly. I then also looked at my deep masseters. The deep masseters is going to be an injection that is 45-degree angles up toward the tragus, and it is going to be a deep, full needle depth injection. Here I am doing crow's feet. As you can see, I have the patient turn all the way towards me, and I'm injecting up and away from that eye over that orbital rim. As you can see, as I'm injecting these, the tissue is blebbing, which is completely normal. You want to be superficial for these injections. Next, we're moving on to trigger points. So what we are doing is we're going in and breaking up the lactic acid and that tension in that tissue. I am tenting up on that tissue with the left hand, and I am using my right hand to kind of utilize that needle, work it back and forth, and break up that tissue. You want to make sure that your needle is no more than 3/4 needle depth and that you are up towards air. So I always tell people, when you're pinching up that tissue, if that needle were to go all the way through the tissue, it should go out towards air. It should never be angled down toward the lung. So as you can see, as I'm hitting more resistance and more tension in that tissue, I'm pushing a little bit of product, and I'm really kind of just breaking up and working that tissue. The biggest thing when injecting this muscle is that you are tenting up on that tissue. So as you can see with that left hand, I'm really tenting up on that tissue. The reason being is you don't want to ever put your patient at risk for a pneumothorax. So you really want to make sure that you have enough adipose tissue that you're injecting into and that you are in that bulk of the tissue. Again, repeating the process on the next trigger point. I'm doing the same technique. I'm really tenting up on that tissue, utilizing that needle about 3/4 depth. And as I'm meeting resistance, I'm pushing more of that toxin and that lidocaine in that area. That lidocaine gives short-term relief, but that toxin allows long-term relief for those patients who have TMJ symptoms.